can you describe what you see in this video?
Yes, I see a child who looks. I see a child with a rash on his face, face, and also there is non-blanching rash, mostly seen on the lower limbs. Um, it is a petechial non-blanching rash on the lower limb. Also, there is some probably looks like a cervical lymph adenopathy and hepatomegaly. So, keeping all of this in view, my most likely diagnosis is this as a child with HSP.
Mm. HSP rash is not like that. Plus, the cervical lymphadenopathy, and also there is hepatomegaly. Someone is palpating the liver. Have you seen hepatomegaly
Yes,
present? So, child, it is comes on history. I'm giving clue. Child who has rash, like thrombocytopenia rash. The child who has, cervical lymphadenopathy. The child is
hepatomegaly.
ill, hepatomegaly present. What is the,
Most likely could be leukemia.
yeah. So we keep in your mind, listen, this year in Pakistan, it's coming autoimmunohemolytic anemia. Uh, Autoimmune, no, sorry, acute hepatitis come probably. And the video
Okay.
was showing that someone doing the doing liver examinations, that is palpating. So when they ask about the DD, if you are confused, what happened? The liver is hepatomegaly that is showing. So the differential diagnosis of hepatomegaly, all things you mentioned. Then the acute
Mm.
hepatitis, the examiner choose and start taking. Acute hepatitis we know that comes on our exam. So everything you know. So that is a leukemia video. I can see a child who has rashes in the body, and the child has cervical lymphadenopathy showing. Then someone palpating the liver. There is hepatomegaly presence. There is someone rash, blanchable blast test is doing. So on top, my diagnosis can be leukemia. What are the DD we are keeping here?
DD of hepatomegaly, so it can be any liver tumors, any
No, no. Here
secondary tumors.
leukemia DD tell me there is rash also. Keep in your mind. So tell. Everything keep. There is rash also.
Okay,
What you
so
keep?
TD of non-blanching rash, ITP, HSP.
Hmm. So meningitis, sepsis, DIC, ITP, hemolytic uremic syndrome, HSP, COVID, even NAI. What happens
drug.
sometimes bruise mark is associated with this type rash. They confuse this with. Okay. So what
Yes.
history we ask?
So again, onset, course, and duration of the rashes. The rash history, about when did you see the rash? Where is the spreading of the rash? And associated fever, weight loss, general features, fever, weight loss, activity, sleep, um, and a history of recurrent infections. Um, and
Yeah. Okay. So during history, I tell you our diagnosis, differential diagnosis we keep in our mind. Easily we can go. First of all, onset, course, and duration. What make it better? What make it worse? We can ask like, is it first time occur, or the onset is sudden or gradual? Then leukemia feature we are keeping in our mind as our top diagnosis. So night fever, weight loss, anorexia, pallor, palpitation, chest tightness, sign of increase in intracranial pressure. These are abdominal distension. Then we keep as henoscorid purpura we are keeping as a rash. So the distribution of the rash we keep in our mind. There is rash. So everything rash related we can tell. Like rash is oozing, rash is itching, painful, painless, distribution of rash. Then is it blanchable or non-blanchable? Okay. Then similar condition in the family we ask. Vaccination status, the child is any chronic disease present or not, fever, weight, activity. So fever, how is the fever, high grade fever or not, weight, so tell. Activity, child is active or not, as meningitis also we are keeping. Okay. And what examination we do?
so again, general physical examination, examination of cervical lymph node examination, abdominal examination, and look for rash and any CNS involvement if there is any because of meningitis for meningitis.
Okay. So examinations always airway, breathing, circulations, the vitals I'm examining. Rash. So there is showing the glass test, the blanchable, non-blanchable. Then he's a male, leukemia or diagnosis. So examine the private area in males because testicular affection occur. Abdomen examinations, cervical lymph nodes not telling that lymph node examinations. Then neurology, MSK, chest and cardiac examinations we are keeping. MSK, joint pain also associated with leukemia. So neurological MSK examination. What investigation we do for leukemia?
Full blood count.
Yes.
Full blood count. Then we do LDH. Use and urea electrolytes. Liver function
Mm,
tests. Um, these are the lab investigations and blood film.
mm. What expect in blood film in leukemia?
So we can see lots of blasts.
Cell. Yes. So we are doing full blood count. Here we can find normocytic normochromic anemia with or pancytopenia, bicytopenia, like only WBC low, everything also low. Peripheral blood film we are doing because of blast cell. Bone marrow biopsy we do because of blood cell more than 30% for confirmation. If CNS involvement we think, then lumbar puncture, AVG electrolyte. Electrolyte important because we know after chemotherapy there is tumor lysis syndrome develop, and the tumor lysis syndrome electrolyte abnormality very important. That is hyperkalemia, hyperuricemia, hyperphosphatemia, or hypocalcemia. Only calcium is low or everything hyper. Coagulation skin we can keep. Then phenotyping for Philadelphia chromosome, genetic testing, PCR, radiology like abdominal ultrasound, X-ray needed. So what is the treatment we give for leukemia?
So treatment for after the marrow biopsy depends upon mm, we give intensive chemotherapy. So the duration of chemotherapy depends upon the type of leukemia.
Actually, we tell nicely. Like first, I will take the history here, video station history. Then after examination and investigation, I will involve multidisciplinary team and the treatment. Multidisciplinary team, my pediatricians, oncologist. We can keep hematology, radiology, lies with the school, psychological support to the family. These are and first regular blood transfusion as the child associated with anemia. So if needed, I will give the blood transfusion. Of course, needed regular blood transfusion, antibiotic we give, chemotherapy we give, radiotherapy we give, and stem cell and bone marrow transplantation is the curative treatment maybe. Okay, stem cell and bone marrow transplantations. What are the poor prognostic factor of acute leukemia?
If it's a child less than 1 year of age, if there's lots of blast cells more than
Hmm.
I'm not sure.
50,000 beginning or anything?
Um,
Okay, I'm telling. Poor prognostic factor first age less than 1 year or more than 10 years. Male African ethnicity. Male is than female because male there is testis it go spread occur. Tumor cell count is before the start treatment more than 50 to 10 to the power 9 per liter. Philadelphia chromosome, CNS involvement, hypodiploidy, persistent leukemic cell blast in bone marrow 4 weeks after induction therapy. So poor less than 1 year, more than 10 years. Male, African ethnicity, Philadelphia chromosomes. Before starting treatment, blast cell is or tumor cell more than 50 into 10 to the power 9 per liter. There is hypodiploidy, that is chromosome less than 44 chromosome, and after treatment 4 weeks it is not improving. So suppose in history also leukemia come, this same management we will telling. But what is the chief complaints occur in the leukemia history, and what are the feature you search leukemia history?
mm,
Hello.
uh, yes. So chief complaints would be it can be anything like rashes or tiredness or recurrent infections or
Mhm.
maybe
Fever, weight
easy
loss.
bruising, fever, weight loss. Yes.
Okay, repeated infections. When we search the history, we'll find that like few months after or few days after he is suffering fever, very weak feeling, pain. That is on. Then when you take starting the history, what are the features you search or find?
This general like there's fever, there's weight loss,
Yes.
uh, activity. He's very tired and fatigued, and he's
Mm,
repeatedly ear infections or chest infections, repeated antibiotic courses.
Mm,
um, and easy bruising, sometimes easily bruising.
mm. Lymphadenopathy can be present, swelling. Is there any swelling in the body? Yes, there is
Amazing.
multiple swelling we find. Abdomen distension. If we ask, there is abdomen because hepatomegaly present, and anemia. He's pale. When you ask about the skin color changes, any skin pigment change or skin pigmentation, also they tell that this is like a small rashes or anything. These are. And testis, we can ask, is there any testis affected or not? If male child, these are leukemia patients. Uh, if
Mm.
it is a bronchiolitis obliterans patient, also admit in hospitals with repeated, like previous last time also admitted, they have also fever, low grade fever, respiratory tract infections. What are the features absent in bronchiolitis obliterans?
They don't have no hepatomegaly or no abdominal distension.
Yes,
No, and
yes.
no easy bruising. Easy bruising is not there.
No skin rash,
No
no
skin
weight
rash.
loss, no weight loss, not any pale, no pale. These are presents because they confuse on exam center. The why it is not leukemia. The child has repeated admissions of that. So when we
Yeah,
take the history, keep in our mind this. So this is all
definitely.
about leukemia video stations. Thank you very much.
Thank you.
What you see in this video.